A very good afternoon to all of you. Today, we are all assembled here to talk about the importance of World Autism Awareness Day 2021 and also World Autism Awareness Month 2021. A couple of us are aware that the United Nations has recognized this World Autism Awareness Day to be celebrated every year in order to understand what autism is, in order to accept autism, as well as create inclusivity for persons with autism spectrum disorders. I will be the moderator for the day today. To introduce myself, I am Dr. Jayashree C. Shanbal. I head the Tele Center for Persons with Communication Disorders and also the chairperson of Autism Spectrum Disorders Unit at the All India Institute of Speech and Hearing. Today, I have with us Mr. Freddie Anthony, who is a faculty in clinical psychology in the Department of Clinical Psychology at the All India Institute of Speech and Hearing, Mysore. A warm welcome to you, Mr. Freddie. We also have with us Dr. Neeraj Kumar Singh, who is also a faculty in audiology in the Department of Audiology at the All India Institute of Speech and Hearing, Mysuru. A warm welcome to you as well, Dr. Neeraj Kumar Singh. First of all, let us understand what is autism or autism spectrum disorders. I think we've been hearing this word on and off from a lot of teachers from schools who wish to understand what it is, a lot of parents who have heard from the other parents, or somebody in the neighborhood who have had a child with autism. So earlier, it would be referred as only autism, but I think it is rightful to call it as autism spectrum disorders because this is not just one heterogeneous group. As it suggests, there are a lot of variants and types and severity of autism spectrum disorders. And within the autism spectrum disorders, autism is one of them. So to give you a brief idea about what this autism spectrum disorders could be, we will have to highlight on the three broad domains that we can consider whether a person has autism spectrum disorders or not. So we have the social domain. Often it is seen that these children with autism spectrum disorders could have poor socialization skills, or rather they would have difficulty in interacting with people or their own peers, sometimes even their own family members. Apart from that, you would also see that these children have problems in communication, which means that a vital part of their development, which is important for interaction using communication, is going to be hampered. Also, sometimes you see a repetitive behavior. Sometimes they're also called as stereotyped behaviors or restricted repetitive behaviors. So you might see that some of these children do not pick up speech and language skills at the appropriate age, which you expect that at least by 1 year a child should start speaking. On the other hand, they don't interact with their own peers, their family members, and you might see other stereotypic behaviors like rocking movement or flapping of hands, or sometimes movements which are not kind of acceptable and are just repetitive without any meaning. So with that brief idea about what autism spectrum disorders is, now I would request Mr. Freddie to answer a few of our questions for the audience so that we can create more awareness about what is this whole thing about autism spectrum disorders. So Mr. Freddie, please tell us at what age does a child develop autism spectrum disorders?
Ma'am, usually the onset is early childhood. And typically what we see is children shows those florid symptoms between 12 months to 24 months. Of course, we can get some hints in the early part also. There could be later onset also. But the typical age of onset where parents are really concerned is between 12 months to 24 months. What's called the second year of life.
Yes, so I do agree with what Mr. Freddie was saying. I think there have been literature which talks about identifying certain early signs of autism spectrum disorders, because I think a lot of parents tell us that probably when my child goes to school, that is when we can identify the condition. But I think there are still some early indicators, some red flags which we could identify at a very early age. And the one that I could immediately think of is a social smile. So whenever a child or a baby, I would say, is looking at the mother, who's her immediate social partner, and that's where he's interacting more with the mother, you see that the child is not looking at the face of the mother, the child is not giving out a social smile. So these are some of the signs, I'm sure Mr. Freddy was talking about it, which you can identify much earlier than 12 months. So that's at a very young age. So apart from that, I think there are a lot of other early signs which we talk about in terms of whether the child is developing verbal communication or non-verbal communication. Very simple thing could be pointing, which comes much ahead of time, less than 6 months itself, which is a very important part of non-verbal communication. And you also see that babbling in a lot of children, research literature has strongly suggested that these children do not give out meaningful babbling, whether it is canonical babbling or it is variegated babbling, which means the child is supposed to use sounds like ba 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 or do do do, and often some of these sounds are depictive of some meaning. So these children are not able to use those part of expressions, and some of them think that very simple thing is responding to name call. I think that's the first complaint that we have often heard when parents come to us, to speech and hearing institutes like ours, wherein they say that my child is not responding to his name call. Okay, and it can be very, within the family itself, they're seeing that much younger child is responding to the name call, but this child is not responding to the name call. So this is, I think, something that calls for a lot of attention. But I would now direct the question to probably Dr. Neeraj Kumar Singh. So Dr. Neeraj, what do you think is happening with the hearing of these children? Because this is the first complaint that we often observe, or this is the first complaint that we often hear from the parents, saying that I'm here to get my child's hearing tested. Otherwise, he seems to be okay. So do you want to comment a little bit on that?
Yeah, I mean, one of the, as you rightly pointed out, one of the major complaints is my child is not responding to the name call, and that could be both related to the actual hearing of the child, or it may even be related to the inattentive behavior, or maybe not associating that is what is his name or
Yes.
her name. So, so in either of these three circumstances, if the child has got slightly poor IQ, does not relate that that name belongs to him, so he does not have to then respond. That is one thing. The second thing, that the child actually may have hearing impairment, because some children with autism do have hearing impairment. So in that case, the child may not respond to the name call, but the child may also not respond to any other environmental sound. So having that understanding and getting to know that from a parent or the caregiver is very important. If the child is not responding to any sound, then probably the child has a hearing impairment also. There is an undercurrent of hearing impairment. If the child is not responding only to his name call or her name call, then possibly it is more to do with the IQ and dissociation of his name with himself.
Correct. So now, since he was telling us that yes, autism spectrum disorders can show up with having no hearing loss at all, or you could also see it seems like the child is having hearing loss because of some IQ issues. Or another aspect I would say is that the whole idea about a child actually responding to a name call, which is part of human interaction, is something that the child generally distances himself. So there has been a lot of literature, I'm sure he also would agree with me, that these are children, it's not that they're not comprehending what is happening around, it's more to do with some kind of a social anxiety that these children have, which repels them away from actually responding to anything that's related to human interaction. And yes, I think an important issue that he was talking about is with respect to the IQ. So there might be a lot of children with autism who actually are associated with having IQ issues. and because of which, that is also hampering to responding to their name call. So, however, I'm sure that's what Dr. Neeraj also means. The protocol, especially when you go to a professional, should be that you get their hearing tested first, you get their IQ tested, okay, and then also get their speech and language assessments done. We'll just take one of the phone calls. Hello. ಹಲೋ
ಹಲೋ ಮೇಡಮ್,
ನಮಸ್ತೆ, ಹೇಳಿ
ಮೇಡಮ್. ಇದು ನಮ್ಮ ಮಗನಿಗೆ ಅವನು ಮಾತಾಡಲ್ಲ. ಅವನು
ಹೇಳಿ
ಮಾತಾಡಲ್ಲ ಅವನು. ಆದ್ರೆ ಅವನು ನಾವು ಏನೇ ಕರೆದ್ರೂ ಅದಕ್ಕೆ ರೆಸ್ಪಾನ್ಸ್ ಮಾಡಲ್ಲ ಅವನು. ಆದ್ರೆ ಅವನು ಮೊಬೈಲಲ್ಲಿ ಏನಾದ್ರು ನೋಡ್ಕೊಂಡ್ರೆ, ಮೊಬೈಲಲ್ಲಿ ಏನಾದ್ರು ಫೋನ್ ಬಂದ್ರೆ ಅದಕ್ಕೆ ರೆಸ್ಪಾನ್ಸ್ ಮಾಡ್ತಾನೆ. ಸೊ ಅದು ಏನಾದ್ರು ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ ಅಂತ ತಿಳ್ಕೊಳ್ಬೇಕು.
ಹೌದು, ಈಗ ನಾವು ಅದ್ರ ಬಗ್ಗೆನೇ ಮಾತಾಡ್ತಾ ಇದ್ವಿ. ಆಕ್ಚುಲಿ ನಮ್ಮ ಹತ್ರ ಡಾಕ್ಟರ್ ನೀರಜ್ ಕುಮಾರ್ ಸಿಂಗ್ ಅವರಿದ್ದಾರೆ. ಎಷ್ಟೊಂದು ಬಾರಿ ಈ ಮಕ್ಕಳಿಗೆ ಕಿವಿ ಕೇಳಿಸ್ಕೊಳ್ಳೋದ್ರಲ್ಲಿ ತೊಂದರೆ ಇರುತ್ತೆ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಅದ್ರ ಜೊತೆಗೆ ಅವ್ರಿಗೆ ಅಕಸ್ಮಾತ್ IQ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದ್ರೆ ಆವಾಗಲೂ ಕೂಡ ಈ ಮಕ್ಕಳು ಸರಿಯಾಗಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇರೋದಿಲ್ಲ. ಆಮೇಲೆ ಸಾಮಾನ್ಯವಾಗಿ ಈ ಮಕ್ಕಳಿಗೆ ಹೇಗಿರುತ್ತೆ ಅಂದರೆ, ಎಲ್ಲಿ ಬೇರೆಯವ್ರ ಜೊತೆ ಬೆರ್ತು ಮಾತಾಡಿ ಕಲ್ತ್ಕೋಬೇಕು ಅಥವಾ ರೆಸ್ಪಾಂಡ್ ಮಾಡಬೇಕು ಅಂತಿರುತ್ತೋ ಅಲ್ಲಿ ಇವರು ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇರೋದಿಲ್ಲ. ಬೇರೆ ಈಗ ಮೊಬೈಲ್ ಫೋನಲ್ಲಾದರೆ ಸುಮ್ಮನೆ ನೋಡ್ಕೊಂಡು ಆಟ ಆಡ್ತಾ ಇರ್ತಾರೆ. ಸೊ ಅವ್ರಿಗೇನು ಅಲ್ಲಿ ಇಂಟ್ರಾಕ್ಟ್ ಮಾಡೋವಂಥ ಏನು ನೆಸೆಸಿಟಿ ಇರೋದಿಲ್ಲ. ಸೊ ನೀವು ಅಬ್ಸರ್ವ್ ಮಾಡಿದ್ರೆ ಮೊಬೈಲ್ ಫೋನಲ್ಲಿ ಅವ್ನು ಮಾತಾಡ್ತಾ ಇರೋದಿಲ್ಲ, ಮೊಬೈಲ್ ಫೋನು ಆಟ ಆಡ್ತಿರ್ತಾನೆ ಅಷ್ಟೇ. ಸೊ ಸಾಮಾನ್ಯವಾಗಿ ಅವರು ರೆಸ್ಪಾನ್ಸ್ ಅನ್ನೋದು ಮೊಬೈಲ್ ಫೋನ್ ಆದರೂ ಇರ್ಬೋದು ಅಥವಾ ಕಾಮನ್ ಆಗಿ ನಾವು ಒಬ್ರಿಗೊಬ್ರು ಮಾತಾಡ್ತಾ ಇರೋ ಅಂಥದ್ದನ್ನು ಕೂಡ ಅವರು ಮಾಡ್ತಾ ಇರೋದಿಲ್ಲ. ಸೊ ಇಲ್ಲಿ ನಮ್ಮ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ನೀರಜ್ ಇದ್ದಾರೆ. ಅವರು ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ನಿಮಗೆ ಅದ್ರ ಬಗ್ಗೆ ಹೇಳ್ತಾರೆ. ಈಗ ಹಂಗೆ ಮಾಡ್ತಾ ಇದ್ರೆ ಮುಂದೆ ಏನು ಮಾಡಬೇಕು? ಸೊ ಐ ಥಿಂಕ್ ವಿ ಹ್ಯಾವ್ ಟು tell them a little bit about, whom should they see in case they find that this child has a problem.
First of all, I don't know whether the child has autism with the complaints that we hear. So the child may or may not have autism. So for that, it's very important that they see a speech language pathologist, a psychologist, and an audiologist, because the complaints are varied. And it is possible that that ಕಿವಿ ತೊಂದರೆ ಇದೆ ಆ ಥರನೂ ಇರ್ಬೋದು ಆ್ಯಂಡ್ ಕಿವಿ ತೊಂದರೆ ಇಲ್ಲ ಆ ಥರನೂ ಇರ್ಬೋದು. ಸೊ ಆ ಕಿವಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದ್ರೆ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗ್ಬಿಡುತ್ತೆ ವೆದರ್ ಹಿಯರಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ದೇರ್ ಆರ್ ನಾಟ್. Likewise, IQ test, I mean, he would be able to elaborate better on that, but that should be done. And speech language evaluation needs to be done because that's one of the complaints, the child is not talking.
ಹೌದು, ಈಗ ಅವ್ರು ಅದನ್ನೇ ಹೇಳ್ತಾ ಇದ್ರು. ಕೇಳಿಸ್ತಿದ್ಯಾ ಮಾತಾಡೋದು? ಈಗ ಅವರು ಅದನ್ನೇ ಹೇಳ್ತಾ ಇದ್ರು. ಈಗ ಈ ಮಗುಗೆ ನೀವು ಕೊಟ್ಟಿರೋ ಮಾಹಿತಿ ಪ್ರಕಾರ ಈ ಮಗುಗೆ ನಿಜವಾಗ್ಲೂ ಆಟಿಸಮ್ ಇದೆಯಾ ಅನ್ನೋದು ಖಚಿತಪಡಿಸ್ಕೋಬೇಕು ಅಂತ ಇದ್ರೆ ನೀವು ಅವ್ರ ಶ್ರವಣ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕಾಗುತ್ತೆ, ಅಂದ್ರೆ ಕಿವಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕಾಗುತ್ತೆ, ಜೊತೆಗೆ IQ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕಾಗುತ್ತೆ, ಹಾಗೂ ಮಾತಿನ ಪರೀಕ್ಷೆ ಅಂದ್ರೆ ಆ ಮಗುವಿನ ಮಾತಿನ ಬೆಳವಣಿಗೆ ಹೇಗಿದೆ ಅಂತ ನಾವು ನೋಡ್ಬೇಕು. ಸೊ ಸುಮಾರು ಜನ ಏನ್ ಅನ್ಕೋತಾರೆ ಅಂದ್ರೆ, ಮಗು ಬೇರೆಯವ್ರ ಜೊತೆ ಬೆರೀತಾ ಇಲ್ಲ ಅಂದ ತಕ್ಷಣ ಅದು ಆಟಿಸಮ್ ಅನ್ನೋ ಒಂದು ಭಾವನೆ ಬಂದ್ಬಿಡುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ನೀವು ಅದರ ಬಗ್ಗೆ ಏನೂ ಡಿಸಿಷನ್ ತಗೋಬೇಡಿ, ತಜ್ಞರ ಹತ್ರ ತೋರಿಸಿ. ಈಗ ನಮ್ಮ ತರ ಸಂಸ್ಥೆ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಅಖಿಲ ಭಾರತ ವಾಕ್ಶ್ರವಣ ಸಂಸ್ಥೆ, ಅದು ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್. ಇಲ್ಲಿ ಬಂದ್ರೆ ನಿಮ್ಗೆ ಎಲ್ಲಾ ತಜ್ಞರು ಜೊತೆಗೆ ಒಂದೇ ಸತಿ ಸಿಗ್ತಾರೆ. ಅವ್ರ ಹತ್ರ ಎಲ್ಲ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿ ನಂತರ ಅವ್ರು ಹೇಳ್ತಾರೆ ನಿಮ್ಗೆ ಈ ಮಗುಗೆ ಈ ತೊಂದರೆ ಇದೆಯಾ ಇಲ್ವಾ ಅನ್ನೋದು ಫಸ್ಟ್ ಖಚಿತಪಡಿಸ್ಕೋಬೇಕು. ಯಾಕಂದ್ರೆ ಅದರ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಥವಾ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಏನಿರುತ್ತೆ ಅದು ಅದರ ಐಡೆಂಟಿಫಿಕೇಶನ್ ಮೇಲೆ ಡಿಪೆಂಡ್ ಆಗಿರುತ್ತೆ. ಸುಮಾರು ಸತಿ ಆಟಿಸಮ್ ಮಕ್ಕಳಲ್ಲಿ ಐಡೆಂಟಿಫಿಕೇಶನ್ ತಪ್ಪಾಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನೀವು ತಜ್ಞರ ಹತ್ರ ತೋರಿಸಿನೇ ಇದನ್ನ ಖಚಿತಪಡಿಸ್ಕೋಬೇಕು ಅಂತ ಡಾಕ್ಟರ್ ನೀರಜ್ ಅವರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
ಸರಿ ಮೇಡಮ್,
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Thank you.
So I think this is one very important thing that Dr. Neeraj was telling us, identification. There are so many myths and so many rumors around this whole thing about autism, that any child who's just not mingling with the other children, they become autistic or they are autistic. Or you will also see that a lot of them think that because the parents are not talking to the child is becoming autistic. So now that really calls for trying to understand what could be the possible causes of autism. I think that's something a lot of people would want to know. But we'll just take this call and then we'll proceed. Hello? ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕೇಳ್ತಿದ್ದೆ ಮೇಡಮ್.
ಕೇಳಿ, ನಿಮ್ಮ ಹೆಸರೇನು ಹೇಳಿ?
ಮೇಡಮ್ ನನ್ನ ಹೆಸರು ಜುಲ್ಫಿಕಾರ್ ಅಹಮದ್ ಅಂತ.
ಸರಿ.
ನನ್ನ ವೈಫ್ ಮಹಾಜಬೀನು. ಹಲೋ.
ಕೇಳಿಸ್ತಾ ಇದೆ.
ಹಲೋ
ಸರ್, ಕೇಳಿಸ್ತಾ ಇದೆ, ಹೇಳಿ.
ಅದೇ ಮೇಡಮ್, ಇವಾಗ ನನ್ಗೊಂದು ಡಾಟರ್ ಇದ್ದಾಳೆ, 13 years. ಸ್ಪೆಷಲ್ ಚೈಲ್ಡ್.
ಓಕೆ.
ADHD. Our problem is our behavior from past 1 year, that is because of lockdown. ನಮಗೆ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್, ಅವಳು ಬಿಹೇವಿಯರ್ ಸ್ವಲ್ಪ ಚೇಂಜ್ ಆಗಿಬಿಟ್ಟಿದೆ ಮೇಡಮ್ ಅವ್ರದ್ದು.
ಓಕೆ.
ಅವ್ಳಿಗೆ ಏನಾದರೂ ಬೇರೆ ಏನಾದರೂ ಕ್ಲಾಸಸ್ ಏನಾದರೂ ಅರೇಂಜ್ ಮಾಡ್ಬೋದಾ ಅಂತ ನಾವು ಎನ್ಕ್ವೈರಿ ಮಾಡೋಣ ಅಂತ.
ಸರ್, ಇಲ್ಲಿ ಮಿಸ್ಟರ್ ಫ್ರೆಡ್ಡಿ ಇದ್ದಾರೆ. ಅವರು ನಮ್ಮ ಕ್ಲಿನಿಕಲ್ ಸೈಕಾಲಜಿಸ್ಟ್. ಅವ್ರು ನಿಮಗೆ ಇದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಹೇಳ್ತಾರೆ. ಹೌದು, ಅವರು. ನೀವು ಯಾವ ಊರು ಸರ್?
ಮೈಸೂರು ಮೇಡಮ್. ನಾವು ಮೈಸೂರಿಗೆ ನಾನು ಶಿಫ್ಟ್ ಮಾಡಿದ್ದೀನಿ ಮಗಳಿಗೆ ಅಂತ.
ಓಕೆ.
ರೆಗ್ಯುಲರ್ ಸ್ಕೂಲ್ಗೆ ಹಾಕಿದ್ದೆ ಅವಳಿಗೆ.
ಓಕೆ.
ಗುಡ್ ಹೋಪ್ ಪ್ರೈ ಸ್ಕೂಲ್ ಅಂತ ಅವಳು 4th standard ಅಲ್ಲಿ ಇವಾಗ ಹೋಗ್ತಾ ಇದ್ದಾಳೆ. ಇಸ್ ಗೋಯಿಂಗ್ ಫಾರ್ ರೆಗ್ಯುಲರ್ ಸ್ಕೂಲ್ ಇಟ್ಸೆಲ್ಫ್.
ಓಕೆ.
ಲಾಕ್ಡೌನ್ ಆದ್ಮೇಲೆ ಅದು ಸ್ವಲ್ಪ ಟಿವಿ ಸ್ವಲ್ಪ ನೋಡಿ ಸ್ವಲ್ಪ ಬಿಹೇವಿಯರ್ ಇದು ಮಾಡ್ತೀವಿ.
ಬಟ್ ಅವಳ ಡಯಾಗ್ನೋಸಿಸ್ ADHD ಅಂತ ಆಲ್ರೆಡಿ ಆಗಿದ್ಯಾ? ನಿಮಗೆ ಗೊತ್ತಿದ್ಯಾ?
ಹೌದು ಹೌದು.
ಎಲ್ಲಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದ್ರಿ?
ಬೆಂಗಳೂರಲ್ಲಿ ನಾನು ಸ್ಪೆಷಲ್ ಬೆತ್ನೀಸ್ ಸ್ಕೂಲ್ ಇತ್ತಲ್ಲ, ಬೆತ್ನೀಸ್ ಸ್ಕೂಲ್ ಐತಲ್ಲ, ಅಲ್ಲಿದ್ಲು ಅವಳು 1 year.
ಓಕೆ.
ಅಲ್ಲಿ ಮತ್ತೆ ಇದಾದ್ಮೇಲೆ ಇಲ್ಲಿ ಮೈಸೂರಿಗೆ ಬಂದ್ಮೇಲೆ ಅವಳಿಗೆ ನಾರ್ಮಲ್ ಆಗಿದ್ಲು, ಅದಕ್ಕೆ ರೆಗ್ಯುಲರ್ ಸ್ಕೂಲಲ್ಲೇ ಹಾಕಿದ್ವಿ. ರೆಗ್ಯುಲರ್ ಸ್ಕೂಲಲ್ಲಿ ಅವಳಿಗೆ ಅಡ್ಮಿಷನ್ ಕೊಟ್ಟರು.
ಓಕೆ.
ಅದಾದ್ಮೇಲೆ ಇದು ಸ್ವಲ್ಪ ಈ ಬಿಹೇವಿಯರ್ ಇವಾಗ ಸ್ವಲ್ಪ ಏನಾಗಿದೆ ಅಂದ್ರೆ ಅವಳು ಟಿವಿ ನೋಡ್ತಾಳೆ, ಇದು ಮಾಡ್ತಾಳಲ್ಲ, ಅದಕ್ಕೆ ನೈಟ್ ಸ್ಲೀಪಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಆಯ್ತು.
ಓಕೆ ಸರ್, ಈಗ ಅದೇ ನಾನು ಹೇಳಿದ್ನಲ್ಲ, ನಮ್ಮ ಜೊತೆಗೆ ಕ್ಲಿನಿಕಲ್ ಸೈಕಾಲಜಿಸ್ಟ್ ಇದ್ದಾರೆ. ಅದಕ್ಕೂ ಮುಂಚೆ ನಾನು ಹೇಳಕ್ಕೆ ಏನು ಇಷ್ಟಪಡ್ತೀನಿ ಅಂದರೆ, ಆ್ಯಕ್ಚುಲಿ ನಾವು ಈ ಪ್ರೋಗ್ರಾಮಲ್ಲಿ ADHD ಮೇಲೆ ಫೋಕಸ್ ಮಾಡ್ತಾ ಇಲ್ಲ. ನಾವು ಫೋಕಸ್ ಮಾಡ್ತಾ ಇರೋದು ಆಟಿಸಮ್ ಮೇಲೆ. ಬಟ್ ಈಗ ನೀವು ಕೇಳ್ತಾ ಇರೋ ಪ್ರಶ್ನೆ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಈ ಮಕ್ಕಳಲ್ಲಿ ಇರುವಂಥ ತೊಂದರೆ ಬಗ್ಗೆ ಕೇಳ್ತಾ ಇರೋದ್ರಿಂದ ನಾವು ಅದನ್ನು ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ನಿಮಗೆ ಆನ್ಸರ್ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀವಿ. ಸೊ ಮಿಸ್ಟರ್ ಫ್ರೆಡ್ಡಿ ಇದ್ದಾರೆ ಇಲ್ಲಿ. ಸೊ ಫ್ರೆಡ್ಡಿ, ಐ ಥಿಂಕ್ he basically wants to know that during the lockdown, the behavioral issues of this child has increased. So one thing is, I'm sure that most of us will agree, you have to get the child here first of all to see the profile, to see the exact profile of whether the child is really ADHD or not, or a child who's really having a behavioral problem. And he's also mentioning that the child is 13 years old, and I think he also wants to know about a little bit about how this problem can be solved and when probably they can come down. Yeah.
Okay, so sir, generally what we see is ADHD is less common in females. So you are talking about your daughter. So I have a hunch that we should have a re-evaluation of your daughter. Point number 1. Point number 2, she is going to a mainstream school. I think during this corona period, most of the schools were doing online classes. So what happened with online classes is the child will stay within the home only. There is no change in the the scenario, the change in the setting. The home has become a school. I am sure most of you will agree. The home has become office, the home has become school, home has become a religious place. Everything has happened. There is a whole mix-up of the identity of the home. So, and I can tell you usually what happens, especially child who is having some amount of behavioral issues, they tend to flare up, tend to increase a lot when they spend more time in the same situation. एक ही जगह में आप थोड़ा और टाइम, जैसे पहले 3 घंटा और 4 घंटा घर में रहता था. हेलो,
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಇವಾಗ ಕೇಳ್ತು.
सो पहले क्या होता था, आजकल स्कूल से आने के बाद, मुस्लिम फैमिली दे कैन अंडरस्टैंड. ठीक है. सो घर से आके yes, so what happens is usually people used to come from school, then they used to
English.
fine, I will continue with the English, no problem.
Hello sir,
I can continue in English.
No problem. So no credit, sir. I can understand. Sir.
Okay, so what happens is, during non-corona period, people used to go to the school and come back maybe towards 3 o'clock, 4 o'clock, and the parents used to take care from there till, let's say, 8 or 9 or 10 o'clock. So there was less amount of time the child used to spend with the parents. Now, because,
Credit, sir. Tell me.
yes, now because of this pandemic, the children are spending more time with the child. Even parents are also spending more time with the child. So there is one term which we generally are very careful. The more the time you spend at home, there is a more chance of problem being increased. For example, there is always, all of us have a patience level, a tolerance level is there. So in a gap of, let's say, 8 hours, you will scold twice. But the same logic, if you take it, in a gap of 24 hours, you may take it 4 or 5 times. So there is a more chance of you losing your patience. Because of we losing the patience, the child also get too much of aggression. So it becomes a cyclical process. So ideally, we will be happy the child goes back to the typical school scenario where there is a different setting, different set of people, different set of teachers. So it is a change of scenario for the child also. Equally, the child, there is a change in scenario for the parents also. This is good for the health of both the parties. The child will also get a refreshing scenario. The parents will also get a refreshing scenario. But the pandemic has changed this scenario. Most of us have started coming together, and what we technically call as expressed emotion. There is a more chance of expression of emotion. There is a less chance of the mental health being in a troubled way. So that's one point. Coming specific to your issue, what happens is within the home also, try to have some kind of an order within your home, so that the things happen in a rhythmic way. For example, there is a class time, let's say 9 o'clock to 10 o'clock, you stick on to that. From them 10 to 11, she can have maybe say TV time. So I try to have a same set of pattern throughout the day, so that people with ADHD, if I assume your diagnosis, the daughter's diagnosis is correct, they tend to have a better understanding if there is a structure within the home. I repeat, structure within homes. The same thing happens most of the day, like eating same time, having breakfast same time, taking to bath same time, taking for a walk same time, rather than shuffling from day 1 to day 2. So try to have same kind of a pattern, especially with a child who is maybe at the higher level of hyperactivity. That can be one thing which you can do it. You should do it in terms of patterning your home. And if you are in Mysore, please come and contact us. Definitely we can have a detailed evaluation and guide you properly also.
Hello.
ಹೇಳಿ ಸರ್.
Hello.
ಹೇಳಿ ಸರ್.
ಮೇಡಮ್ ಅವ್ರು ಹೇಳಿದ್ರು ಪ್ಯಾಟರ್ನ್ ಮಾಡಬೇಕು.
ಹೌದು.
ಒಂದ್ಸರಿ ನಾವು ಮೀಟ್ ಮಾಡಿ ಒಂದು
ಹೌದು
ಅನಾಲಿಸಿಸ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಒಳ್ಳೇದಲ್ಲ.
ಖಂಡಿತ ನೀವು ಇಲ್ಲಿ ಬಂದು ಇಲ್ಲಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ಯಾಕಂದ್ರೆ ಇದು ಈಗ ನೀವು ನಮ್ದು ಆಲ್ ಇಂಡಿಯಾ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಮಾನಸ ಗಂಗೋತ್ರಿಯಲ್ಲಿ ಇರೋದು ಸರ್. ನಮ್ಮ ವೆಬ್ಸೈಟು ಇದೆ www.aiish.mysore.in ಅಂತ. ಮಾನಸ ಗಂಗೋತ್ರಿಯಲ್ಲಿ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಅಂತ ಹೇಳಿದ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ. ಹಾ, ಸೊ ಇದು ನಾವು ನೀವಿಲ್ಲಿ ಬಂದು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ನಿಮಗೆ ಇಲ್ಲಿ ಎಲ್ಲ ರೀತಿಯ ತಜ್ಞರು ಇರ್ತಾರೆ, ಎಲ್ಲ ಪ್ರೊಫೆಷನಲ್ಸ್ ಇರ್ತಾರೆ. ಅವ್ರು ನಿಮಗೆ ಪರೀಕ್ಷೆ ಮಾಡ್ಬಿಟ್ಟು ಹೇಳ್ತಾರೆ. ನೀವು ಇಲ್ಲಿ ಬಂದು ರಿಜಿಸ್ಟ್ರೇಷನ್ ಮಾಡಿಸಿ ಸರ್, ಅಲ್ಲಿ ನಿಮಗೆ ಡೈರೆಕ್ಟ್ ಮಾಡ್ತಾರೆ. ಹೌದು ನೀವು ಇದರಲ್ಲೂ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೊಳ್ಬಹುದು. ವೆಬ್ಸೈಟ್ ಇಂದ, ನಮ್ಮ ವೆಬ್ಸೈಟ್ ಇಂದ ಕೂಡ ನೀವು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೋಬಹುದು. ಇಲ್ಲಾಂದ್ರೆ ನೀವು ಇಲ್ಲಿ ಡೈರೆಕ್ಟ್ ಆಗು ಬರ್ಬೋದು. AIISH Mysore MYSORE.in ಅಂತ .in ಆಯ್ತಾ? ಹಾ, ಇಲ್ಲಿ ಬನ್ನಿ ಸರ್, ನಿಮ್ಗೆ ಡೈರೆಕ್ಟ್ ಮಾಡ್ತಾರೆ. ಯಾಕಂದ್ರೆ ಪ್ರತಿಯೊಂದು ದಿವಸನೂ OPD ಬೇರೆಯವ್ರದ್ದು ಇರುತ್ತೆ. ಸೊ ಅದು ಯಾರು ಅಂತ ನಾವು ಸ್ಪೆಸಿಫಿಕ್ ಆಗಿ ನಿಮ್ಗೆ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಬಟ್ ಆ ಮಗುನ್ ತೊಂದರೆ ನೋಡ್ಕೊಂಡು ನಿಮ್ಗೆ ಆ ಪ್ರೊಫೆಷನಲ್ ಹತ್ರನೇ ಕಳಿಸ್ತಾರೆ.
ಈಗ ನಾನು ASD ಮತ್ತೆ
ಏನ್ ಹೇಳಿ? ASD ಮತ್ತು ADHD ಅಲ್ಲಿ ಏನು ಡಿಫ್ರೆನ್ಸ್ ಅಂತನಾ? ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಸರ್?
ಹೇಳಿ ಹೇಳಿ ಹೇಳಿ.
ASD ಅಂದ್ರೆ ಆಟಿಸಮ್ ಸ್ಪೆಕ್ಟ್ರಮ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅಂತ, ADHD ಅಂದ್ರೆ ಅಟೆನ್ಷನ್ ಡೆಫಿಸಿಟ್ ಅಂಡ್ ಹೈಪರ್ ಆಕ್ಟಿವಿಟಿ ಡಿಸಾರ್ಡರ್ ಅಂತ. ಈಗ ADHD ಮಕ್ಕಳಲ್ಲಿ ಆಟಿಸಮ್ ಇರಬೇಕು ಅಂತ ಇಲ್ಲ, ಅಥವಾ ಆಟಿಸಮ್ ಮಕ್ಕಳಲ್ಲಿ ADHD ಇರಬೇಕು ಅಂತ ಇಲ್ಲ. ಸೊ ADHD ಮಕ್ಕಳಲ್ಲಿ ನಿಮ್ಗೆ ಗೊತ್ತಿರೋ ಹಾಗೆ ಹೈಪರ್ ಆಕ್ಟಿವಿಟಿ ಇರುತ್ತೆ, ಅಟೆನ್ಷನ್ ಪ್ರಾಬ್ಲಮ್ ಇರುತ್ತೆ, ಮತ್ತೆ ಅವರು ಒಂದು ಕೆಲಸನ ಪೂರ್ತಿ ಕೇಳಿಸ್ಕೊಳ್ದೇನೆ ಹಂಗೇನೆ ಮಾಡೋಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡ್ತಾರೆ, ಅದನ್ನ ಇಂಪಲ್ಸಿವಿಟಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಆಟಿಸಮ್ ಅಲ್ಲಿ ಸಾಮಾನ್ಯವಾಗಿ ಅವ್ರಿಗೆ ಸೋಷಿಯಲೈಸೇಷನ್ ಮಾಡೋದು ಕಷ್ಟ ಆಗ್ತಿರುತ್ತೆ, ಬೆರೆಯೋದು ಕಷ್ಟ ಆಗ್ತಿರುತ್ತೆ, ಮಾತಿನ ಬೆಳವಣಿಗೆ ತಡವಾಗಿರುತ್ತೆ, ಜೊತೆಗೆ ಬೇರೆ ಬೇರೆ ತರದ ಬಿಹೇವಿಯರ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಕೂಡ ಇರುತ್ತೆ.
ನಾನು ಚೆಕ್ ಮಾಡ್ತೀನಿ ಮೇಡಮ್, ಬೆಂಗಳೂರಲ್ಲೂ ಬಂಜಾರಲ್ಲಿ
ಓಕೆ ಸರ್. ಸರ್ ನೀವು ಒಂದು ಕೆಲಸ ಮಾಡಿ, ನೀವು ಇಲ್ಲಿ ಬನ್ನಿ, ನಾವು ಅದನ್ನ ಫಸ್ಟ್ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳೋಣ, ಆಟಿಸಮ್ ಅಥವಾ ADHD ನ ಮಗುಗೆ ಅಂತ ತಿಳ್ಕೊಂಡು ಆಮೇಲೆ ನಿಮ್ಗೆ ನಾವು ಹೇಳ್ತೀವಿ ಮುಂದಕ್ಕೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ. ಇರುತ್ತೆ ಸರ್, ಅದು ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ಡೀಟೇಲ್ಸ್ ಇರುತ್ತೆ ಸರ್. ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಕಾಲಿಂಗ್. Okay, so I think we quite spent some time telling him about what he has to do, and especially I think it was quite relevant, his doubt with respect to knowing what is the difference between autism versus ADHD, because I think colloquially everybody uses it very synonymously, they use but it's not so. Technically it is not so. So no matter what, I would still suggest that they come to the professionals, get them checked, and also get more information on that. So we take another call. Hello. Hello.
ಹಲೋ, ನನ್ನ ಹೆಸರು ನಳಿನಾ ಅಂತ. ನಾನು ಡಾಕ್ಟರ್ ಜೊತೆ ಮಾತಾಡಬೇಕು.
ಹೇಳಿಮ್ಮ, ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಏನು ಅಂತ ಹೇಳಿ.
ನನ್ನ ಮೊಮ್ಮಗಳು ಈಗ 4.5 years. ಸ್ವಲ್ಪ ಕಮ್ಯುನಿಕೇಶನ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ಅಂದ್ರೆ ಯಾವ ಮಕ್ಕಳ ಜೊತೆ ಸೇರಲ್ಲ, ಈವನ್ ಪೇರೆಂಟ್ಸ್ ಜೊತೆನೂ ಒಂಥರ ಅಷ್ಟೊಂದು ಮಾತಾಡೋದಿಲ್ಲ. ಒಂಥರ ಇದು ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ತೋರಿಸಿದ್ರು, ಅವ್ರು ಇರೋದು UK ನಲ್ಲಿ. ಅಲ್ಲಿ ಡಾಕ್ಟರ್ಗೆ ತೋರಿಸಿದ್ರು, ಅವ್ರೇನೋ ಟ್ರೇಸಸ್ ಆಫ್ ಆಟಿಸಮ್ ಅಂತ ಹೇಳಿದ್ದಾರೆ, ಆದ್ರೆ ಇನ್ನು ಕನ್ಫರ್ಮ್ ಮಾಡಿಲ್ಲ ಅವರು. ಹೀಗಾಗಿ ಈಗ ಈಗ ಸೇರಿಸಿದ್ದಾರೆ ಈ ಲಾಸ್ಟ್ ಇಯರ್ ಇಂದ. ಈಗ ಸ್ಕೂಲ್ ಸೇರಿದ್ಮೇಲೆ ಸ್ವಲ್ಪ ಪರವಾಗಿಲ್ಲ, ಒಂಚೂರು ಸ್ವಲ್ಪ ಮಾತಾಡ್ತಾಳೆ, ಬಟ್ ಒಂಥರ ಕಾನ್ಸಂಟ್ರೇಷನ್ ಇಲ್ಲ ಯಾವ್ದ್ರ ಮೇಲೆ. ಆತರ ಅಂದ್ರೆ ಸ್ಕೂಲ್ನಲ್ಲಿ ಎಲ್ಲಾ ಮಕ್ಕಳು ಒಂಥರ ಮಾಡ್ತಿದ್ರೆ ಇವಳೇ ಡಿಫ್ರೆಂಟ್ ಆಗಿ ಬಿಹೇವ್ ಮಾಡೋದು. ಅವರೆಲ್ಲ ಆಟ ಆಡ್ತಿದ್ವಿ, ಇವಳೇ ಸಪರೇಟ್ ಆಗಿ ಆಟ ಆಡೋದು, ಯಾರ ಜೊತೆ ಮಿಕ್ಸ್ ಆಗಲ್ಲ, ಆತರ ಆಗಿದೆ. ಅದು ನಿಜವಾಗ್ಲೂ ಆಟಿಸಮ್ ಏನಾ ಅಥವಾ ಇದು ಕೆಲವ್ರಿಗೆ ಲೇಟ್ ಆಗಿ ಮಾತ್ರ ಬರುತ್ತೆ ಅಂತಾರಲ್ಲ, ಆ ತರನಾ ಏನು ಅಂತ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ.
ಓಕೆ, ಸೊ ಇವಾಗ ಇವಳು ಇನ್ನು UK ಅಲ್ಲೇ ಇದ್ದಾಳಾ?
ಹಲೋ,
ಎಲ್ಲಿದ್ದಾರೆ ಇವ್ರು ಇವಾಗ? ಮೈಸೂರಲ್ಲಿದ್ದಾರಾ, UK ಅಲ್ಲಿದ್ದಾರಾ?
UK ನಲ್ಲಿದ್ದಾರೆ.
ಅಲ್ಲೇ ಇದ್ದಾರಾ? ಓಕೆ. ಸೊ 7.5 years ಅಂತ ನೀವು ಹೇಳಿದ್ರಿ ಅಲ್ವಾ ಮಗುಗೆ? 7.5 years. ಈಗ 4.5 years. ಓಕೆ. ಈಗ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಅಟ್ ಎ ಡಿಸ್ಟೆನ್ಸ್ ನಾವು ಅವಳಿಗೆ ಆಟಿಸಮ್ ಇದೆಯಾ ಇಲ್ವಾ ಅಂತ ಹೀಗೆ ಅವಳನ್ನ ನೋಡದೆ ಹೇಳಕ್ ಆಗೋದಿಲ್ಲ. ಬಟ್ ನೀವು ಹೇಳ್ತಾ ಇರೋ ಕೆಲವು ಫೀಚರ್ಸ್ ನೋಡಿದ್ರೆ ಅದು ಆ ಡೈರೆಕ್ಷನ್ ಅಲ್ಲಿ ನಮ್ಗೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದೆ. ಕೇಳಿಸ್ತಿದ್ಯಾ? ಕೇಳಿಸ್ತಾ ಇದೆಯಮ್ಮ?
ಹಲೋ,
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಹಲೋ,
ಇನ್ನೊಂದ್ಸತಿ ಕಾಲ್ ಮಾಡ್ತೀರಾ ವಾಪಸ್ಸು?
ಓಕೆ.
ಈಗ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ನಿಮ್ಗೆ?
ಕೇಳಿಸ್ತಾ ಇದೆ.
ಓಕೆ. ಸೊ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೆ, ನೀವು ಹೇಳ್ತಾ ಇರೋ ಫೀಚರ್ಸ್ ನೋಡಿದ್ರೆ ಅದು ಸುಮಾರಷ್ಟು ಆಟಿಸಮ್ ಕಡೆನೆ ನಮಗೆ ಡೈರೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದೆ. ಬಟ್ ಅದನ್ನ ನಾವು ನೋಡ್ಬೇಕು, ಮಗುನ ಡೈರೆಕ್ಟ್ ಆಗಿ ನೋಡ್ಬೇಕು. ಸೊ ಇವಾಗ UK ಇಂದ ಇಲ್ಲಿ ಕರ್ಸ್ಕೊಳ್ಳೋ ಅಂತ ಪಾಸಿಬಿಲಿಟಿಕಿನಾನು ನಮ್ಮಲ್ಲಿ ಟೆಲಿಮೋಡಲ್ಲಿ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡ್ತಾ ಇದೀವಿ. ನಾವು ಟೆಲಿ ಅಸೆಸ್ಮೆಂಟ್ ಅಂತ ಮಾಡ್ತೀವಿ ವರ್ಚುವಲ್ ಮೋಡಲ್ಲಿ. ಸೊ ಅವರು ನಮ್ಮನ್ನ ಕನೆಕ್ಟ್ ಮಾಡ್ಬೋದು ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲೇನೆ. ಟೆಲಿ ಸೆಂಟರ್ ಫಾರ್ ಪರ್ಸನ್ಸ್ ವಿತ್ ಕಮ್ಯುನಿಕೇಶನ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅಂತ ಇದೆ, TCPD ಅಂತ. ನಮ್ಮ ವೆಬ್ಸೈಟ್ಗೆ ಹೋದ್ರೆ ನಿಮಗೆ ಅಲ್ಲಿ ಹೇಗೆ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೋಬೇಕು ಅನ್ನೋದೆಲ್ಲ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ನೀವು ಆ ಮಗುವಿನ ತಾಯಿಗೋ ತಂದೆಗೋ ಅಲ್ಲಿಂದ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಫಿಕ್ಸ್ ಮಾಡಿಕೊಂಡು ನಮ್ಮ ತಜ್ಞರು ಇರ್ತಾರೆ, ಇಲ್ಲಿ ಎಲ್ಲ ತಜ್ಞರು ಇರ್ತಾರೆ, ಅವರು ಅವನ್ನ ವರ್ಚುವಲ್ ಮೋಡಲ್ಲೇ ನೋಡ್ತಾರೆ. ನೋಡ್ಬಿಟ್ಟು ನಂತರ ನಿಮಗೆ ಒಂದು ಐಡಿಯಾ ಕೊಡ್ತಾರೆ ಅದ್ರ ಬಗ್ಗೆ. ಯಾಕಂದ್ರೆ ನೀವು ಹೇಳ್ತಾ ಇರೋದು ಈಗ ಉದಾಹರಣೆಗೆ ಅವಳು ಸರಿಯಾಗಿ ಇಂಟ್ರಾಕ್ಟ್ ಮಾಡ್ತಾ ಇಲ್ಲ, ಅಥವಾ ಬೇರೆ ಮಕ್ಕಳು ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಬೇರೆ ಥರನೇ ಬಿಹೇವ್ ಮಾಡ್ತಾ ಇದ್ದಾಳೆ, ಅಥವಾ ಸ್ಪೀಚ್ ಪಿಕಪ್ ಮಾಡಿಲ್ಲ ಅನ್ನೋಂಥದ್ದೆಲ್ಲ ಫೀಚರ್ಸ್ನು ಆಟಿಸಮ್ ಕಡೆನೇ ನಮ್ಗೆ ಡೈರೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದೆ. ಬಟ್ ಒಂದು ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿಸ್ಕೊಳಕ್ಕೆ ಹೇಳಿ, ಅಪಾಯಿಂಟ್ಮೆಂಟಿಂದ ಟೆಲಿ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿಸ್ಕೋಬೇಕಾಗುತ್ತೆ. ಹೌದು ಹೌದು, ವಿಡಿಯೋ ಕಾಲ್ ಥರಾನೇ ಮಾಡ್ತೀವಿ ನಾವು. ಮಾಡಿಬಿಟ್ಟು ಅಲ್ಲಿಂದ ನಿಮಗೆ ಹೇಳ್ತೀವಿ ಇದನ್ನ ಡಯಾಗ್ನೋಸಿಸ್ ಏನಿರ್ಬೋದು ಅನ್ನೋದು ನಿಮಗೆ ತಿಳಿಸಿ ಹೇಳ್ತೀವಿ. ಪ್ಲಸ್ ಆ ಪ್ರೊಫೆಷ್ನಲ್ಸು ಅಲ್ಲಿ ಯಾರ ಹತ್ರ ಅವ್ರು ತೋರಿಸಿದಾರೋ ಅವ್ರ ಜೊತೆನೂ ನಾವು ಇಂಟ್ರಾಕ್ಟ್ ಮಾಡ್ತೀವಿ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ಡಯಾಗ್ನೋಸಿಸ್. ನಮ್ಮ ವೆಬ್ಸೈಟು www.aiish Mysore mysore.in. ಓಕೆ, ಗೊತ್ತಾಗುತ್ತೆ. ರೈಟ್ ಹ್ಯಾಂಡ್ ಸೈಡ್ ಅಲ್ಲಿ ಟೆಲಿ ಅಸೆಸ್ಮೆಂಟ್ಗೆ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ ಇರುತ್ತೆ, ಅಲ್ಲಿಂದ ನೀವು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೊಳ್ಬಹುದು.
ಅಂದ್ರೆ ನಾವು ಮನೆಯಲ್ಲಿ
ಇಲ್ಲ, ನೀವು ಫಸ್ಟ್ ಪ್ರೊಫೆಷನಲ್ ಹೆಲ್ಪ್ ತಗೋಬೇಕು. ಅವ್ರು ನಿಮ್ಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ ಹೇಗೆ ಮಾಡಬೇಕು ಅನ್ನೋದನ್ನೆಲ್ಲ ಡೆಮಾನ್ಸ್ಟ್ರೇಟ್ ಮಾಡ್ತಾರೆ. ಅದಾದ್ಮೇಲೆ ನೀವು ಮನೆಯಲ್ಲಿ ಅದನ್ನ ಅಭ್ಯಾಸ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ.
ಆಕ್ಚುಲಾಗಿ ಅವಳಿಗೆ 1.5 years ಇದ್ದಾಗ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಎಲ್ಲ ಇವೆಲ್ಲ ರೈಮ್ಸ್ ಆಗ್ಲಿ, ಆಲ್ಫಾಬೆಟ್ಸ್, ನಂಬರ್ಸ್, ಈವನ್ ಪ್ಲಾನೆಟ್ಸ್ ಇದು ಹೆಸರುಗಳು ಎಲ್ಲ ಹೇಳ್ತಾ ಇದ್ಲು. ಈಗ ಹೇಳ್ತಾ ನಾಕ ಇದೆ ಅವಳಿಗೆ, ಬಟ್ ಹೇಳುವಾಗ
ಹೌದು, ಆತರ ಕೆಲವು ಮಕ್ಳು ಇರ್ತಾರೆ. ಈ ಆಟಿಸಮ್ ಸ್ಪೆಕ್ಟ್ರಮ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅಲ್ಲಿ ಕೆಲವು ಸಬ್ ಗ್ರೂಪ್ಸ್ ಅಲ್ಲಿ ಆತರ ಮಕ್ಳು ಇರ್ತವೆ. ಕಲ್ತ್ಕೊಂಡು ನಂತರ ನೆಕ್ಸ್ಟ್ ಅವರು ಅದನ್ನ ಆಮೇಲೆ ಈ ಯೂಶುವಲಿ 2 to 3 year old ಪೀರಿಯಡ್ ಅಲ್ಲಿ ಈ ತರ ಒಂದು ಕಮ್ಯುನಿಕೇಶನ್ ಅಲ್ಲಿ ಅಪ್ಸ್ ಅಂಡ್ ಡೌನ್ಸ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಕೆಲವರು ಅದನ್ನ ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡ್ಕೊಂಡ್ ಬಿಡ್ತಾರೆ, ಇನ್ ಕೆಲವರು ತೊಂದರೆ ಇರೋ ಮಕ್ಕಳು ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡ್ಕೊಳಲ್ಲ, ಮರ್ತೋಗ್ಬಿಡ್ತವೆ. ಓಕೆನಾ? ಸೊ ಮೋಸ್ಟ್ಲಿ ಅವಳದು ಇನ್ನೂ ಅದೆಲ್ಲ ಸ್ಟೆಬಿಲೈಸ್ ಆಗಿಲ್ಲ, ಹಾಗಾಗಿ ಅವಳು ಅದನ್ನು ಉಪಯೋಗಿಸ್ತಾನೂ ಇಲ್ಲ ಅಂತ ನಾನು ಅನ್ಕೋತಾ ಇದ್ದೀನಿ. ಬಟ್ ಇನ್ ಎನಿ ಕೇಸ್ ನಾನು ಹೇಳೋದು, ನೀವು ಪ್ರೊಫೆಷ್ನಲ್ಸ್ ಹತ್ರ ಅದನ್ನ ಟೆಲಿ ರಿಹ್ಯಾಬ್ ಅನ್ನೋ ಆಪ್ಷನ್ ಇದೆ. ನಾವು ಟೆಲಿ ರಿಹ್ಯಾಬ್ ಮಾಡ್ತಾ ಇದೀವಿ, ಅಂದ್ರೆ ಟೆಲಿ ಮೂಲಕ ಡಿಸ್ಟೆನ್ಸ್ ಅಲ್ಲೇನೆ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಮಾಡ್ತಾ ಇದೀವಿ, ಅವ್ರು ಇಲ್ಲಿ ಬರ್ಬೇಕಾಗಿಲ್ಲ. ಸೊ ಅಲ್ಲಿನೂ ಅಟ್ಲೀಸ್ಟ್ ನೀವು ಅದನ್ನಾದ್ರೂ ನೀವು ಪ್ರೊಫೆಷನಲ್ಸ್ ಹತ್ರ ಮಾಡಿಸ್ಕೊಂಡು ನಂತರ ನೀವು ಹೋಮ್ ಟ್ರೈನಿಂಗ್ ತರ ಮನೆಯಲ್ಲೇ ಮಾಡ್ಕೋಬಹುದು. ಓಕೆನಾ?
ಮೆಡಿಸಿನ್ ಅಂತ ಏನಿಲ್ಲ ಅಲ್ವಾ ಮೇಡಮ್?
ಮ್ಯಾಮ್, ಇದಕ್ಕೆ ಆಟಿಸಮ್ಗೆ ಮೆಡಿಸಿನಲ್ ಕ್ಯೂರ್ ಅನ್ನೋದು ಏನು ಇರೋದಿಲ್ಲ, ಆಯ್ತಾ? ಅದಕ್ಕೆ ಇರೋಂಥ ಬೇರೆ ತೊಂದರೆಗಳೇನಾದ್ರೂ ಇದ್ರೆ, ಕೆಲವು ಆಟಿಸಮ್ ಮಕ್ಕಳಿಗೆ ಸೀಜರ್ಸ್ ಇರ್ಬೋದು, ಬೇರೆ ರೀತಿಯಾದ ಮೆಡಿಕಲ್ ಇಶ್ಯೂಸ್ ಇದ್ರೆ ಅದಕ್ಕೆ ತಕ್ಕಂತೆ ಅದಕ್ಕೆ ಮೆಡಿಸಿನ್ಸ್ ಕೊಡ್ತಾರೆ. ಬಟ್ ಅದರಿಂದ ಆಟಿಸಮ್ ಕ್ಯೂರ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಇಲ್ಲ. ಸೊ ಇದು ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಮೇಲೇನೆ ಬೇಸ್ ಆಗಿರುತ್ತೆ. ಸೊ ಈ ಮಗುಗೆ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಬೇಕಾಗುತ್ತೆ, ಥೆರಪಿ ಬೇಕಾಗುತ್ತೆ. ಓಕೆ,
ಸೆಕೆಂಡ್ ಮಗು ಇದೆ, ಇದ್ರ ಎಫೆಕ್ಟ್ ಅದ್ರ ಮೇಲೆ ಏನಾದ್ರು ಆಗುತ್ತಾ?
ಸೆಕೆಂಡ್ ಮಗು ವಯಸ್ಸು ಎಷ್ಟು?
ಈಗ 2 ವರ್ಷ, 2 ಕಾಲ.
2 ಕಾಲ. ಆಕ್ಚುಲಿ ಈಗ ಜೆನೆಟಿಕ್ ಟೆಸ್ಟಿಂಗ್ ಅಂತ ಕೆಲವು ಕಡೆ ಮಾಡ್ತಾರೆ, UK ಅಲ್ಲೂ ಇರುತ್ತೆ, ಆಪ್ಷನ್ಸ್ ಇರುತ್ತೆ, ಅದನ್ನ ನೀವು ಪ್ರಯತ್ನ ಮಾಡ್ಬೋದು. ಬಟ್ ಆ ಮಗು ಅಕಸ್ಮಾತ್ ಚೆನ್ನಾಗಿ ಡೆವಲಪ್ಮೆಂಟ್ ಆಗ್ತಾ ಇದೆ, ಅಲ್ಲೇ ಪ್ರೊಫೆಷನಲ್ಸ್ ಹತ್ರನೇ ತೋರಿಸಿ. ಅಲ್ಲಿ ಮಗು ಚೆನ್ನಾಗಿ ಡೆವಲಪ್ಮೆಂಟ್ ಆಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಅದನ್ನ ಸ್ವಲ್ಪ ಮಾನಿಟರ್ ಮಾಡಬೇಕು. ಯಾಕಂದ್ರೆ ಮೊದಲನೇ ಮಗುಗೆ ರಿಸ್ಕ್ ಆಲ್ರೆಡಿ ಇರೋದ್ರಿಂದ ಈ ಮಗುಗೆ ರಿಸ್ಕ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಅವಾಗ ನೀವು ಆದಷ್ಟು ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿ ಅಲ್ಲಿ ಡೆವಲಪ್ಮೆಂಟಲ್ ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ಸ್ ಅಂತ ಇರ್ತಾರೆ, ಅವ್ರ ಹತ್ರ ಹೋದ್ರೆ ಅವ್ರು ನಿಮ್ಗೆ ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿ ಫಾಲೋ ಅಪ್ ಮಾಡ್ಬಿಟ್ಟು ಮಗು ನಾರ್ಮಲ್ ಆಗಿ ಗ್ರೋ ಆಗ್ತಾ ಇದೆಯಾ ಇಲ್ವಾ, ಎಲ್ಲ ಏರಿಯಾಸ್ ಅಲ್ಲೂ ಸರಿಯಾಗಿದೆಯಾ ಇಲ್ವಾ ಅನ್ನೋಂಥದ್ದನ್ನ ಅವ್ರು ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ. ಓಕೆನಾ? Okay ma'am, thank you for calling. Bye. There's actually one question from our Facebook live. One Mrs. Harshita Ravi, she says, my son is 4.3 years old. In Aish they referred autism at risk. His speech is delayed, mainly his eye contact is less. So she asked, does autism go away in future? So maybe Mr. Freddy, can you highlight a little bit on her question?
So, as per your information, what we have made is a at-risk child. We have not yet confirmed this child is having autism spectrum disorder. So, that is one point you have to be alert with, aware of. We have yet to confirm it because it takes some amount of time for us to build rapport and time to give a particular diagnosis. That's one part. Point number two, as such, autism, as ma'am was referring to the previous slide, as such, autism is it's a lifelong kind of a condition. It stays with you. The early intervention will definitely help to improve the quality of life, pick up language, communication skills, rather than a later intervention. Don't wait for, let's say, one of the mother was referring to, people say it automatically speech will come, let's say after 5 years. His father was also speaking very late. These are some of the myths which we see in our population. So please don't buy in those arguments. It's very difficult. That's not the right way of doing it. As early as possible, start the intervention so that we can improve all those skills so that he will have a better quality of life as it goes progress. Don't waste this crucial time waiting for 6 years, 7 years, 5 years. So as such, to answer your question, so for point number one, we are yet not confirmed, but there is a chance. Point number two, you please start intervention right now rather than waiting for a longer time. And the last point is what we generally say is lifelong autism is a lifelong disorder which is going to be staying till the last moment of life. So that's a very crisp reply for your question.
Yeah, I think I agree with him because more than thinking about whether the condition is going to be completely cured, I think it's the acceptance that should come through. Okay, and then they can start helping the child. Otherwise, I think most parents, what they do is the moment they get to know that, okay, this condition does not have a cure, they tend to seep down. They start thinking that nothing can be done with this child anymore and the world is over and the life is gone. No, it's not like that. I think it's always wise to accept the condition, okay, and see what best you can do, because there are professionals who can help them out. And there are children and there have been adults and adolescents with autism who have actually done very well in their lives. They can actually do really well. So I hope that answers Mrs. Harshita's question. Very valid. I would agree with that. So apart from that, I think I'll come back to Dr. Neeraj Kumar Singh. We were talking about the kind of auditory issues that these children can have. Do you want to highlight on any other kind of auditory issues that possibly are seen in children with autism more commonly and which requires some attention in terms of intervention?
Yes, these children with autism can have two kinds of auditory issues. One could be the hypersensitivity to sound. So some children will have specific sounds to which they are hypersensitive. When that sound comes, they cannot tolerate it. So you will see them closing the ears. That's a very typical sign. Some children are hypersensitive to just loudness of the sound. So any sound which is loud, they are hypersensitive to that, so they do not tolerate that. So any loud sound, they'll close the ears. There is another variety of children with autism where they have hyposensitivity to sound. No matter what sound, they don't pay attention to that. It doesn't trouble them. They might seem like they have some hearing issues. Some of them may actually have hearing issues and some of them may not have. It's just that they don't pay attention to any of those. Right? So all these kind of issues could be there, and all of them need to be identified. I need to know whether this child has got hypersensitivity to specific sound, hypersensitivity to all sounds, or hyposensitivity. So depending upon that, the treatment will be completely different.
Correct.
And the kinds of, most often the complaints are, rather than the hyposensitivity, the complaints are more hypersensitivity, either to specific sound or to all sounds. So when this is a complaint, then actually there is a lot of work done to see why this happens and to see whether some kind of strategies work. One of the things, like if you see a child who is extremely hypersensitive, then the first solution could be just use of some ear protective devices. So they could use the ear muffs or ear plugs or something like that. The flip side of that is this child could become even more hypersensitive to sounds because he's being shielded from that. It's something like all of us, if you ask us to walk maybe barefoot on a concrete road or something, we don't tolerate that because there is a lot of pricking. But you look at people in village, they don't have that issue. That's because they're used to it. So if you try to protect yourself more and more, then more and more sensitivity issues come. So, but if the child is really hypersensitive to a sound, instead of putting him into panic stage and all that, it is better that we use that ear protective device, and then maybe gradually work towards using one of the two. And in my personal opinion, I think the one which I will talk later is actually better. But the other method is a therapy called as auditory integration therapy, where where some people believe that if you filter a particular kind of music, and that music, when it is played to the child for half an hour every day for say 20 or 30 days, then there is overall improvement and the child is no longer as sensitive. But then there is no real published literature which shows like this was a randomized control trial or something of that kind, which will ensure that no, they covered all the loopholes and still this was found to be effective. So that kind of a literature is not available. The one which is most often agreed upon by people is use of desensitization, and there are a couple of ways in which you can use it. One is clinician-oriented desensitization. So clinician dictates as to how the desensitization is done. The clinician identifies if there are specific sounds, and those specific sounds, probably it would be something like you start off from a distance of say 20 feet, and it is at a lower level, and then you gradually, slowly, day after, means today you started from 20 feet, tomorrow you make an attempt to bring it closer and closer and closer, till the child is able to accept it from a very near place. And then you probably take it to the natural sound level. So that's the clinician-oriented or clinician-dictated desensitization. These days you also have computer, there can be a computer program. There are softwares developed and they are available in market to buy for using with such kind of children. And those can be used where either the parent, or if the child, if it is a slightly older child who can understand all these and can do it himself, then he or she himself or herself can do it, or the parent can do it, where this will be like recorded sounds or those kind of things. That is, we are basically trying to create a virtual environment where we do the desensitization. So these two, the last two which I talked about, that is the clinician dictated or computer oriented programs, these two have got maximum efficacy and they are well accepted world over, and there is published literature which shows that a lot of children have improved and they are no longer hypersensitive to the sound. They can now tolerate those sounds which they couldn't earlier. Now this is mainly telling you that you are probably dealing with the psychological aspect, because if neurologically there is something like that, then this is not going to help. If the child has had a bad experience and has developed a phobia towards that sound, desensitization works the best.
I'll just interrupt you here, Dr. Neeraj. We'll take this call and then we'll continue. Hello? Hello?
Hello?
Lima.
Hello? Can I speak in English?
Sure. Yeah, please go ahead. Please tell me your name.
My name is Reshma.
Okay, Reshma. Yeah.
I'm calling for my son who is 4 years old.
Okay.
So, around 2.5 years, we could find he was not having his speech, he was not talking, and of course he showed few signs of autistic behavior. So now we have actually got him into an institute at Orissa at Bhubaneswar.
Okay.
So there they are giving him speech therapy as well as other occupational and behavioral therapies.
Okay.
So they have actually asked us for the diet.
Okay.
So I want to know how far is the diet good? Basically, it is millet based with no wheat and rice.
Mm-hmm.
Apart from that, even they have asked to give omega supplements and even this apple cider vinegar.
Mm-hmm.
way? In the sense, this is totally different to our regular food habits.
Okay.
So will this help?
Yeah, Mrs. Reshma, first of all, I just thank you for that question, because I know there are a lot of parents who have this kind of a question wherein they've seen changes in behavior with respect to diet. But I'd also like to tell you that amongst the three of us today, we don't have a professional who can right away answer that question for you, because we don't have a dietitian here on the platform today, but we have a program exclusively by the dietitian on 30th of April. Okay, so I would request you to kindly get back to us at that time and get all your clarifications and doubts, cleared from the dietitian on that day.
Now, further, I want to ask,
Yeah.
now he started getting the therapies almost after 3.5 years because of the lockdown, etc. We couldn't send him anywhere.
Okay.
So now, actually, now it's like 4 months that he started going there, and there is a lot of improvement.
Okay.
So I want to know that how much time it would actually take to achieve
Okay.
normalcy, or will start speaking and behaving normal.
Okay, Mrs. Reshma, what is his mental age? What is his IQ?
I don't know.
So we need some more information on this. Like, we'll require to know
Hello?
what is his. Can you hear me?
Hello.
Can you
Am I
hear?
audible? Hello.
Yeah, we can hear you. Can you hear me? Hello?
Hello. Yes.
Yeah, you can hear me, right? Okay,
Yes.
so what I was trying to tell you is we need a little bit more information on areas like his mental age. We also want to know what is his language age, especially in terms of his comprehension as well as his expression. Okay, and a lot more information on how his pattern of development is taking place. Okay, so what I would suggest to you is you can contact us through our telecenter. Okay, and it is very much on our website. You can just type in www.aishmysore.in. Okay, and then you can fix an appointment for teleassessment. We'll have professionals on the platform there, and they will explain to you regarding this.
I want to know a general opinion that usually we have seen a lot of cases.
Yeah, no, that is why I'm saying, why I asked you this information is, it is highly dependent on these factors. Okay, so unless and until we don't know what is his cognitive age or what is his language age, we will not be able to tell you how the child is going to progress. Because autism can have different severities also. Okay, it can range right from,
I want to further ask, what
Can you
about
hear
their
me?
schooling and education? So,
Mrs. Reshma, can you hear me?
whether they can go to a normal school, will the schools actually accept, or is there any category, or is it a particular type of disability which is recognized or not?
Mrs. Reshma, are you able to hear me?
Yeah, I'm able to hear you.
Okay, so I was telling you about the severity. I'll just complete that for you.
Yeah, sure.
Children with autism can have various severity. So, can you hear me now?
Now it's audible.
Yeah, they can have
In
different.
between, the voice is getting broken. Actually.
Yeah, I
Hello?
think this. Can you hear now?
Hello?
Could you please come to a network area?
Yeah, now I'm able to hear you.
Okay, fine. So I was saying that autism can have different severities.
Hello?
Mrs. Reshma, I think there is some problem with the network. Could you call us back again?
Yeah, now I'm able to hear. Please continue.
Okay, so severities can vary in autism. That's what I was trying to tell you, which the professionals have to kind of inform you after the assessment, because the progress of the child can only be told once we know, all of these information from the child. Okay, so now you can ask me your next question. You were talking about his school.
Yes.
Yeah, please ask.
Schooling, and I want to know whether this is recognized as a particular disability, whether normal schools will take them.
Yes, it is. It
Should
is
I
recognized.
think about his studies further?
It is recognized as a disability. Okay. And it is recognized as a disability under the Rights of Persons with Disability Act of India in 2016. Okay. So this act has actually included 21 disabilities, of which autism is one of them. So all the facilities and all the right to education that other children with disabilities are supposed to have, even the children with autism will also have. So they can have get into a school, a normal school. But I think what is also important for you is preparation of this child to get into a normal school. Okay, and this kind of preparation is required through therapy. So it's always good that we start off with therapy, okay, and then proceed with the schooling. So the professionals will tell you exactly what is the time then when you can put the child into a schooling. So I would also like to tell you that in our next series, which is on 16th of April, we have a special educator as well on the platform. So you could contact us for more issues related to schooling of these children with autism. So we will be.
Who has to certify them with the disability? Any speech therapist, psychologist?
There is a board. There is a board of member which includes a psychologist. Okay, so they will certify whether this child has a problem or not. Okay, and once the certificate is issued, you can avail the benefits. Okay, yeah. And please do get in.
3.5 age was late for him to start with therapy, or is it fine?
3.5 years is, see, actually a child is supposed to start speaking at least by 1 year of age. Okay, so if you ask me as a speech pathologist, I would still say that it is slightly a little delay, but he's still in the critical period. Okay, generally critical period is from birth till around 15 years of age, which is, 3.5 is still a good time when you have got the child into rehabilitation. Okay, so there are a lot of them who come during schooling period when it becomes very difficult for us to actually start working with this child. So as early as possible you identify them, it's all the better for bringing out good progress in these children. Okay, so don't worry, however late or early it is, I think 3.5 is not so late. You can still work with this child and bring about some good amount of progress. And let us try to first understand what is his levels in terms of speech skills or motor or cognition and all of that. Okay, so you can get in touch with us on that through our website.
Okay.
Okay, thank you so much for calling, and you please call us on 16th as well as 30th April. We will have professionals from the other field as well. Thank you. We'll take another call. Hello. ಹಲೋ
ಹಲೋ,
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಹಾ ಮೇಡಮ್ ಕೇಳಿಸ್ತೀನಿ.
ಹೇಳಿ, ನಿಮ್ಮ ಹೆಸರು ಹೇಳಿ.
ನಮ್ಮ ಹೆಸರು ಚಂದ್ರಕಲಾ ಅಂತ ಮೇಡಮ್.
ಓಕೆ.
ರಾಯಚೂರಿಂದ ಮಾತಾಡ್ತಾ ಇರೋದು.
ಓಕೆ.
ನಮ್ಮ ಮಗ 6 ವರ್ಷ ಮುಗೀತು ಮೇಡಮ್, ಇವಾಗ 7ನೇ ವರ್ಷ ರನ್ನಿಂಗ್ ಅಂತ ಹೇಳಿ.
ಓಕೆ.
ADHD, ಆಟಿಸಮ್ ಮತ್ತೆ MD ಅಂತಾರಲ್ಲ, ಆ ಥರ ಸಮಸ್ಯೆಯಿಂದ ಬಳಸ್ತಾ ಇದ್ದಾನೆ. ನಾವು 4 ವರ್ಷದಿಂದನೂ ಮೈಸೂರಿಂದ ಇದನ್ನ ತಗೊಂತಾ ಇದ್ದೇವೆ, ಥೆರಪಿ. ಇವಾಗ ಆನ್ಲೈನ್ ಥೆರಪಿ ತಗೊಂತಾ ಇದ್ದೇವೆ, ವಿಡಿಯೋ ಕಾನ್ಫರೆನ್ಸ್ ಅಂತ.
ಓಕೆ.
ಆಮೇಲೆ ಶಿವಮೊಗ್ಗದಲ್ಲಿ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂತಾ ಇದ್ದೇವೆ, ಮೆಡಿಸಿನ್ ಟ್ರೀಟ್ಮೆಂಟ್.
ಓಕೆ.
ಅದಕ್ಕೆ ಮೇಡಮ್ ಈಗ 3 ವರ್ಷದಿಂದ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಔಷಧಿ ಎಲ್ಲ ಕೊಡ್ತಾ ಇದ್ದಾರೆ ಮೇಡಮ್. ಅದಕ್ಕೆ ಅದನ್ನ ಸ್ಟಾಪ್ ಮಾಡ್ಬೇಕಾ ಅಥವಾ ಥೆರಪಿ ಜೊತೆಗೆ ಅದನ್ನ ಕಂಟಿನ್ಯೂ ಮಾಡ್ಬೇಕಾ ಅಂತಂದ್ರೆ ನಮಗೆ ಗೊಂದಲ ಆಗ್ತಾ ಇದೆ.
ಮೆಡಿಕೇಶನ್ ಯಾವ್ದಕ್ಕೆ ಕೊಡ್ತಾ ಇದ್ದಾರೆ? ಹೈಪರ್ ಆಕ್ಟಿವಿಟಿಗ?
ಹಾ ಮೇಡಮ್.
ಓಕೆ, ಅದನ್ನ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರನೇ ಕೇಳ್ಬಿಟ್ಟು ಅವ್ರ ಹತ್ರ ಸಲಹೆ ತಗೋಬೇಕು, ಆಯ್ತಾ? ಡಾಕ್ಟರ್ ಹತ್ರ ನೀವು ಕೇಳ್ಬಿಟ್ಟು ಯಾವ ಮೆಡಿಕೇಶನ್ಸ್ ಅಂತ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ತೋರಿಸಿ ಅವ್ರ ಹತ್ರ ಸಲಹೆ ತಗೊಳ್ಳೋದು ಬೆಟರ್. ನಿಮ್ಗೆ ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ ಕೊಟ್ಟಿದಾರ ಅದನ್ನ? ಮಕ್ಕಳ ಡಾಕ್ಟ್ರಾ? ಸರಿ. ಸೊ ಇಲ್ಲಿ ನಮ್ಮಲ್ಲಿ ಈಗ ಸದ್ಯಕ್ಕೆ ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ ಇಲ್ಲ. ನಾವು 30ನೇ ಏಪ್ರಿಲ್ ಅಂದ್ರೆ 30th ಏಪ್ರಿಲ್ಗೆ, ಇದೇ ತಿಂಗಳು 30ನೇ ತಾರೀಕಿಗೆ ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ ಇರ್ತಾರೆ ನಮ್ಮ ಜೊತೆಗೆ, ಸರಿನಾ? ಆವಾಗ ನೀವು ಮತ್ತೆ ಇನ್ನೊಮ್ಮೆ ಕಾಲ್ ಮಾಡ್ಬೋದು.
ಆಮೇಲೆ ಬೆಂಗಳೂರೊಳಗೆ ಸ್ಕೂಲ್ ಇದೆ ಅಂತ ಇದಾರಲ್ಲ ಮೇಡಮ್, ಆಟಿಸಮ್ ಸ್ಕೂಲ್ ಇದೆ ಅಂತ, ಅಲ್ಲಿಗೆ ಹಾಕ್ಬೇಕಾ ಅಥವಾ ಮನೆಯಲ್ಲೇ ಇಟ್ಕೊಂಡು ನಾವು ಥೆರಪಿ ಕಂಟಿನ್ಯೂ?
ಇಲ್ಲ, ನೀವು ನಿಮ್ಗೆ ಇವಾಗ ಕರೆಂಟ್ ಆಗಿ ಥೆರಪಿಸ್ಟ್ ಮತ್ತು ನಿಮ್ಮ ಸ್ಪೆಷಲ್ ಎಜುಕೇಟರ್
ಹಾಕಿದ್ರೆ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗ್ತಾನ ಬೇಗ ಅಂತ.
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಹಲೋ,
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆಯಮ್ಮ? ಹಲೋ.
ಹಾ ಹಲೋ ಮೇಡಮ್,
ಕೇಳಿಸ್ತಿದ್ಯಾ ಈಗ?
ಇವಾಗ ಬೆಂಗಳೂರಲ್ಲಿ ಸ್ಕೂಲ್ ಇದೆ ಅಂತಿದಾರಲ್ಲ ಮೇಡಮ್, ಆಟಿಸಮ್ ಸ್ಕೂಲು.
ನಾನು ಮಾತಾಡೋದು ಕೇಳಿಸ್ತಾ ಇದೆಯಮ್ಮ?
ಹಾ, ಇವಾಗ ಕೇಳಿಸ್ತಾ ಇದೆ.
ಓಕೆ, ನೀವು ಆನ್ಲೈನ್ ಥೆರಪಿ ತಗೋತಿದ್ದೀರಲ್ವಾ
ಹಾ ಮೇಡಮ್.
ಆಯುಷಿಂದ? ನಿಮ್ಮ ಥೆರಪಿಸ್ಟ್ ಅಥವಾ ನಿಮ್ಮ ಸ್ಪೆಷಲ್ ಎಜುಕೇಟರ್ಗೆ ಕೇಳಿ, ಯಾಕಂದ್ರೆ ಅವ್ರಿಗೆ ಆ ಮಗುವಿನ ಲೆವೆಲ್ ಎಲ್ಲ ಗೊತ್ತಿರುತ್ತೆ. ಆ ಶಾಲೆಗೆ ಹಾಕ್ಬೋದಾ ಹಾಕ್ಬಾರ್ದಾ ಅಂತ ಅವ್ರು ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ.
ಹಾ ಮೇಡಮ್.
ಆಯ್ತಾ? ಓಕೆ, ಬೇರೆನಾ ಪ್ರಶ್ನೆ ಇತ್ತಾ? ಥ್ಯಾಂಕ್ ಯು. So I think a lot more relevant calls that we had. I think we've almost come to the end of the program today. And I know Dr. Neeraj was talking about issues in children with autism. Yeah, autism, auditory integration that we were talking about still requires a lot of research reports to be published. So it's again my urge to the public that before you step into any kind of therapy, just ensure from professionals that it is really an evidence-based program that is going to help the child or not. And unless or until it is a proven technique, please don't go by it or spend too much of money and time on certain things which may not be really useful for these children with autism. So we've almost come to the end. I would request each one of you, Dr. Neeraj probably, to just give us a take-home message on this day of World Autism Awareness Day to our public.
I would talk from audiology point of view, and I would say that keen observation of child's behavior, whether responding to name call, not responding to name call, any kind of sounds, whether the child is hypersensitive to the sound or not hypersensitive to the sound. And also, since I work a lot in vestibular area, also observing things like whether when an object goes from a child's visual field, whether the child is able to track it or not. This could be very early sign. It could be as early as before 6 months itself. So these are the kind of things that one needs to look at, and that could give you, from an audiology point of view, it will give you some indication that there could be a possibility of such a thing. Of course, that has to be then confirmed with all other tests, but parents need to observe carefully, and when they find something like that, they don't have to panic, but they should make an appropriate approach, get the child tested, and get an appropriate diagnosis. If that happens early enough, the child could make a lot of good progress.
Okay, I think that definitely makes a lot of sense. I hope our viewers as well as listeners have heard that. So, Mr. Reddy, the take-home message from your side, please.
So, this occasion, I would rather say autistic kids are a different kid. They are not disabled to be kept aside. They are different. And all of us know difference is something to be celebrated.
Right.
We have to celebrate our difference. We also tell in India, unity in diversity kind of thing. Difference is something to be celebrated, not to be saying that he is different, you don't want to be in our group. So difference is something to be celebrated. And don't look down upon them. They are different, that's it. So difference is something we have to, this day is meant for that only, to make sure that people are different, they have their own life, and we have to appreciate each one's difference.
Yeah, totally agree with you. I think that's another reason why I would say this occasion is very apt, because we are actually celebrating the differences that we think we have with autism, not really trying to pull them away from the crowd, but actually to include them. So I think it's all about making people understand, making people accept them as they are, okay, and also to create a sense of an environment where they can be included with all other persons in the environment. So thank you so much for joining in, and it was an absolute pleasure having both of you here. And I hope we were able to convey information as much as possible within the short time that we had. I'm sure we'll have a lot more questions. I request all of you to please post in your questions on the FB Live that is going on, or otherwise you can always get into our website and write to us. We will be able to answer your questions. Thank you so much.